Living with joint pain isn't easy, but understanding what's behind it can change everything. Today, we're diving into what gout really is, what causes it, and the early warning signs you should never ignore. Stay with us. Your health journey starts here. Gout is often misunderstood as just a painful swelling in the big toe. But it's much more than that. Gout is actually a type of arthritis caused by a buildup of uric acid crystals in the joints. When too much uric acid stays in the blood, it can form sharp crystals that settle in the joints, leading to sudden attacks of intense pain, swelling, redness, and warmth. For older adults, gout can become a serious problem if it's not managed properly. It's not just about pain. It can affect daily life, mobility, and overall health. Understanding what gout is, why it happens, and how to recognize the early signs can make a huge difference in managing it. In this video, we'll talk about what gout really is, the main causes behind it, and the key symptoms and early warning signs to watch out for. Knowledge is power, and with the right information, you can take control and protect your health. Let's dive in. Part 1. What is gout? Gout is a form of arthritis that occurs when uric acid builds up in the blood and forms crystals inside the joints. Normally, uric acid dissolves in the blood and passes through the kidneys into the urine. However, sometimes the body either produces too much uric acid or the kidneys don't get rid of it properly. When uric acid levels stay high, sharp crystals start to form around joints, leading to sudden and very painful inflammation. These flare-ups often happen at night and can be so intense that even a light touch on the skin feels unbearable. The most common place for gout to appear is the big toe. But it can also affect other joints, like the ankles, knees, elbows, wrists, and fingers. Some people might experience one flare-up and not have another for months or even years. Others might have repeated attacks, leading to joint damage over time. Gout is often called the disease of kings because it was linked to rich foods and luxury in the past. But today, we know that gout can affect anyone, especially older adults. It's important to understand that gout is not just about diet. Genetics, medical conditions, medications, and lifestyle all play a role. Gout is a chronic condition. That means once someone has it, the body tends to keep producing high levels of uric acid unless changes are made. Without proper management, the inflammation can lead to permanent joint damage and even affect the kidneys and heart. But the good news is that with early recognition and simple lifestyle changes, gout can be controlled very well. Many people live active, healthy lives even with a diagnosis of gout. Part 2. Causes of gout. There are several reasons why uric acid builds up to dangerous levels in the body. First, diet plays a role. Foods that are high in purines, such as red meat, organ meats like liver, seafood like shrimp and sardines, can raise uric acid levels. When the body breaks down purines, uric acid is produced. Eating too many purine-rich foods can tip the balance. Second, drinks matter too. Alcohol, especially beer and spirits, can interfere with the body's ability to get rid of uric acid. Sugary drinks, particularly those with high fructose corn syrup like sodas, can also increase uric acid production. Third, certain health conditions can raise the risk of gout. People with high blood pressure, diabetes, kidney disease, and obesity are more likely to develop gout because these conditions affect how the body processes uric acid. Fourth, some medications can also trigger gout. Water pills, often used to treat high blood pressure or heart conditions, can reduce the kidney's ability to flush out uric acid. Low-dose aspirin and some immunosuppressive drugs can have a similar effect. Fifth, genetics matter. If gout runs in the family, there is a higher chance of developing it. And finally, aging itself increases the risk, as kidney function naturally declines over time, making it harder to remove uric acid efficiently. While it might sound overwhelming, the key is to understand your personal risk factors and make small changes where possible. Simple steps like adjusting the diet, staying well hydrated, managing weight, and monitoring health conditions can help keep gout under control. Part 3. Symptoms and early warning signs. Gout often announces itself suddenly and loudly. The most common early warning sign is a sudden, intense pain in a joint, most often the big toe. This pain usually strikes at night, waking people up from sleep. The affected joint becomes red, swollen, warm to the touch, and extremely tender. Even the weight of a bedsheet can cause unbearable discomfort. Some people describe the pain as sharp, throbbing, or crushing. It can reach its worst point within just a few hours. After the worst of the attack, the pain may slowly ease over several days to a week. Other early signs to watch for include stiffness in the joint after the pain subsides, a lingering feeling of discomfort, and sometimes a mild fever. If gout is not treated early, attacks can become more frequent, last longer, and affect more joints. In the long run, untreated gout can cause lumps under the skin called tophi. These are collections of uric acid crystals that feel like hard bumps and can lead to permanent joint damage. It's important to take any sudden joint pain seriously, especially if there's swelling, redness, and warmth. Prompt treatment can shorten an attack, prevent damage, and make future flare-ups less severe. Early diagnosis usually involves a physical exam, a review of symptoms, and sometimes a test of the joint fluid to look for uric acid crystals. The earlier gout is recognized and managed, the better the long-term outcome. Conclusion: gout is a painful condition, but it's also a manageable one. Knowing what causes gout, recognizing the symptoms, and taking early action can make a big difference. For seniors, protecting joint health and overall well-being is vital to maintaining independence and quality of life. Managing gout is not just about avoiding certain foods, it's about understanding the whole picture, including medical conditions, medications, and lifestyle choices. If you notice any signs of gout or have risk factors, talk to a healthcare provider. The earlier you catch it, the easier it is to control. Remember, with the right knowledge and small daily habits, you can live well and stay active even with gout. If you found this helpful, don't forget to like, subscribe, and hit the notification bell for more health tips tailored for seniors. Take care of yourself, and remember, small steps today lead to a healthier tomorrow. Thanks for watching, and see you next time.